Now, this story, 5 years after the Life Esidimeni tragedy, a formal inquest has begun to determine if anyone can be held criminally liable. 144 psychiatric patients died when the Provincial Health Department moved them from a private facility to unregistered NGOs. The inquest is set to run until Friday. It's being presided over by Judge Munua Tifo at the High Court in Pretoria. Apologies for that. Former Gauteng Health MEC Esidimeni Tragedy is among those accused of culpable homicide and negligence. ETV News and sports reporter Riante Padayachee following the proceedings for us and joining us now here on the Midday View. Riante, good afternoon. It's the second day of the inquest. What are we hearing so far in those testimonies today?
Good day, Bradan. Well, today we're actually hearing from the second witness, Mr. Masuku Makachwa. And back in 2015, he was then, the managing director of Life Esidimeni. A lot of his testimony, or his statement rather, was read out by the NPA's advocate, Marie Marriott, this morning. And a lot of his statement actually dealt with the termination of the contract between the Gauteng Health Department and Life Esidimeni. What he detailed in his statement was that then Health MEC Kedani Mahlangu had made her intentions known back in 2015 that they wanted to terminate the service level agreement or contract with Life Esidimeni for two specific reasons. One was budgetary requirements, and the second was that, they wanted to align the province's mental health service with the national mental health policy strategy. This essentially meant that they wanted to move or reduce the number of patients in at least 5 Life Esidimeni facilities across the province, which obviously cared specifically for patients with mental health issues. And what they wanted to do was to get them integrated back into their communities and their homes and essentially have their families care for them. Unfortunately, Makachwa said that it was a very frustrating process trying to discuss this with Mahlangu. She didn't really avail herself, to discuss things through. Her decision was made. It was hard to change her mind in any kind of way. But let's take a listen to this bite as to, he cited in his statement some of the reasons Mahlangu gave as to how or why it was important for mental health patients to be reintegrated back with their families and live in their communities.
The MEC refused to enter into discussion, and she advised us that she had made the decision. She also mentioned that in Brazil, 1, there are no mental health institutions. MHCUs live with their families. And 2, if they were aggressive, they walk the streets in chains, accompanied by their family members. She, in brackets, MEC, close bracket, also emphasized that she has a brother who is mentally ill and her family looks after him. She stated that the families are shunning away from their responsibilities. That is why the MHCUs are in our facilities. On accommodation in poor family housing, she said that she also used to sleep under a stove because there was not adequate space or room in the house. The MHCUs can also do the same.
Riante, I guess the inquest is continuing this afternoon. What can we expect next? Do you know?
Well, Bradan, it's obviously going to deal with a little bit of cross-examination of Makachwa. There are many parties involved in this inquest, and everybody has the opportunity to cross-examine right after a witness has given their testimony. I think it's really, really shocking, though. I mean, Ms. Mahlangu's legal counsel are also present. This morning, though, they made the Judge Tefo, understand that they could only cross-examine this afternoon if they wished to, as their senior counsel would only be available then. But a lot of questions. It's possible that they will be cross-examining because it seems like the Gauteng Health Department gave Life Esidimeni a really difficult time back in 2017. Other issues were raised, like at one stage the Gauteng Health Department owed Life Esidimeni facilities about 17 million rand. And even though the money only came in the following financial year, they continued their services. They took care of these patients who obviously needed critical, essential care. Makachwa also spoke about the fact that they try to intervene at every step to try and facilitate the relocation of these patients to what we know now were absolutely inadequately equipped facilities to care for them. Sadly, though, Bradan, you know, that happened and 144 patients died, and now this inquest is hopefully going to get them justice.
Riante, thank you very much. Riante, the ETV News and Sports reporter. It's 29 minutes to 2.